video will be talking about these pointers. Is painful period normal? Why is my period suddenly painful? How to relieve painful period cramps? Can pain relieve stop menstruation? Can painful menstruation cause infertility? Can painful menstruation be cured completely? What will make period pain worse? And menstruation pain relief medicine. Number one, is painful period normal? Yes and no. Yes, if the person is experiencing pain for the first time that they are seeing their period, or within 6 months that they saw their period first, yes, painful period is normal and it is called primary dysmenorrhea. No, if the person was having painless periods and then suddenly started having painful period, it is not normal and the person needs further medical investigation. And those type of period pain is called secondary dysmenorrhea. So primary dysmenorrhea is normal, secondary dysmenorrhea is not normal. The second question is, why is my period suddenly painful? Like I explained before, if someone has sudden period pain after having series of painless periods, then it is not normal and it is called secondary dysmenorrhea. And there are several conditions that could be causing that. Secondary dysmenorrhea is caused when there is a secondary underlying condition predisposing the period to be painful. Such condition could be polycystic ovarian syndrome, fibroid, endometriosis, pelvic inflammatory disease, which will occur infection, toilet infection, yeast infection, and hormonal imbalance. They can cause and predispose sudden painful menstruation. How to relieve painful period? You can use drugs, over-the-counter pain relief drugs. You can incorporate some lifestyle modification. You can do some home remedy for painful period, and there is also non-pharmacological, meaning non-use of drug. There are other methods without drug that you can use. The other method without drug include use of heat, use of massage, and then yoga. Use of heat, you can get a heating pad, or you can buy hot water bottle. If you live in this part of the world, in Nigeria, in Africa, you can go to a pharmacy shop and buy hot water bottle and put warm water. Do not put hot water so that you will not scald or injure your skin. Put warm water in the bottle and place it on your pelvic. Massage your back, massage the place that are aching you, because primary dysmenorrhea can actually dilate to the back. It can cause back pain, waist pain, pelvic pain, lower abdominal pain. So place the heating pad or hot water bottle there. Another thing is to take a hot bath, take a hot shower, or fill the bathtub with hot water and soak yourself inside. Then massage. You can use essential oil and massage your stomach, massage your body, or you can go for a body spa if you have the money. Then you can also do yoga. There's some yoga that helps in painful menstruation relief. Breathing exercise, meditation yoga, they can help painful menstruation. To help you relax, reduce stress, and release endorphin. Another one is exercise. You can do some exercise that will help tone the muscle and release endorphin, and this can lead to relief of painful menstruation. But for you to use the exercise and the yoga method, you have to incorporate the exercise and the yoga in your daily life, not when you've already started having the painful period. You start like a month, every month, incorporate it in your daily life. You can start the exercise 1 week to the expected date of the period flow. You can start 1 or 2 weeks to it. But the lifestyle modification, you need to do those ones on a daily basis. For drug gives you instant relief. Drug gives instant relief from painful menstruation. Home remedy for painful menstruation give also instant relief. So the first method give instant relief, which is use of drug. The third method, use of home remedy, also gives instant relief. But the use of lifestyle medication, you have to incorporate in your daily life. And non-pharmacological method, some of them which includes yoga and exercise, you have to incorporate a week or 2 weeks before the expected period flow. For massage and use of heat, you can do it when the period, or even a day before the period starts. Lifestyle modification includes eating balanced diet, incorporating the 6 classes of food: water, protein, carbohydrate, vitamins, mineral, fat in your food. In each plate of food that you take, you incorporate the 6 classes of, cut down on processed food like carbonated drinks, food that contain high fat in it. Cut down on them because they cause bloating, which can be making your period pain to be worse. Then take a lot of water. Take at least 1.5 liters of water daily. You can take 1.5 to 2.5 liters of water every day. Can you measure 1.5 or 2.5 liters of water? If you live in Nigeria, a sachet of water is 500 ml, which is 0.5 liters. So if you take 3 of that sachet water every day, if you take 1 sachet in the morning, 1 sachet in the afternoon, 1 sachet in the night, you are good to go. That is 1.5 liters. If you take 4 of it, that's 2 liters of water. If you live in other parts of the country, a glass of cup is assumed to be 200 mils. So you do the calculation. That means you need about 8 glasses. Yeah, you can take 2 in the morning, 2 in the afternoon, 2 in the night, 2 in the midnight. Yeah, that will make up for taking 1.5 liter. Approximately is actually 1.6 liters of water every day. Home remedy that you can use is turmeric, ginger, cinnamon. Okay, so how can you do this? You get 1 stick of turmeric, 1 stick of ginger, you wash them and you blend them with 1 cup of water. You can peel off the back or leave it with the back and then blend with 1 cup of water. Add 1 spoon of cinnamon powder into it, or if you don't have the cinnamon powder, you can buy the stick in the market and blend it and keep, and then add 1 spoon of cinnamon, 1 tablespoon of cinnamon powder, boil for 5 minutes, allow to cool to lukewarm water, and drink it. You can scale up the method that I mentioned. You can use 2 sticks of ginger, 2 sticks of very important information. Please do not use the NSAIDs that I mentioned in this video. If you have ulcer or asthma, talk with your pharmacist before you use any drug. Of turmeric and 2 tablespoons of cinnamon and 2 cups of water. You can scale it up, but remember that once the component that you missed, once it is over 1 day, 24 hours, discard whichever one that is remaining. Use of drug: start with acetaminophen, which we all call paracetamol. Start with paracetamol, 2 tablets, that's 500 milligrams, 2 tablets 2 times or 3 times daily. If you didn't get any relief, use other pain relieving medication like ibuprofen, 400 milligrams, 1 tablet 3 times daily after food. Diclofenac, 50 milligrams, 2 times daily after food. Naproxen, 50 milligrams, 2 times daily after food. Or even ibuprofen, or even felvin, cyclophenol. There's so many other classes under that NSAID, pain relieving drugs. If single drug is not relieving the drug for you, if you try 2 or 3 single drugs and there is no relief, try combination drug. There's some combination drug like paracetamol and diclofenac, paracetamol and caffeine, ibuprofen and caffeine. Try those combinations. I use a combination called diclofenac, paracetamol and clozazone. This is the combination that I use because I tried single combination and it didn't work, and I went for that triple in one drug, and it worked for me very, very well because I have very severe dysmenorrhea. I have severe primary period pain. Can pain relief stop menstruation? Yes and no. Yes, pain relief like diclofenac and said use at high dose. Instead of using 50 milligrams, if you use 100 milligrams of diclofenac, it can actually delay. It does not completely stop menstruation. It delays the coming of the menstruation. It can delay it by an hour, few hours, like 12 hours, a day or 2. It can delay menstruation flow, but it does not completely stop it. The mechanism is the contraction of the end of the uterus is reduced by those pain relieving drugs, and the contraction of the uterus is what helps the sludging or the shedding of the uterine lining. So if there is reduced contraction, there will be reduced shedding or even completely non-shedding of the uterine lining for a while, until the body get used to the drug, and then the body can rearrange by increasing contraction to just remove the uterine lining, because it has to be shed for a new menstrual cycle to start. So no, if you are using drugs like paracetamol, some home remedy and non-pharmacological method, so no, it will not completely stop menstruation. It will only delay it for a while. Can painful menstruation cause infertility? No, painful menstruation does not cause infertility, but secondary dysmenorrhea, which is sudden painful menstruation, can indicate poor reproductive health. It can indicate that there is infection. It can indicate that there is fibroid. It can indicate that there is something wrong with the reproductive health. So when someone suddenly have period pain, they need to go see a health professional, their doctor, a gynecologist. They need to go see a gynecologist or their family doctor for further investigation. Can painful menstruation be cured completely? Yes, if the person is having secondary dysmenorrhea, which is caused by other underlying factors like I mentioned before, like fibroid if the fibroid is removed, like endometriosis if it is controlled, like polycystic ovarian syndrome when it is controlled, like pelvic inflammatory infection when the infection has been completely treated. Yes, it will stop. But no, if the person is having primary dysmenorrhea, no, pain relief is not going to completely cure it. Every month the person might still feel pain, but once they use their living method, whichever one they choose, whether drug or non-pharmacologic method, the pain will relieve. But over time and with time, the degree and severity of pain will start reducing and will probably completely stop, especially when women put to bed. Once I gave birth, my painful menstruation is almost minimal. It's almost not there again. So yes and no. What can cause or worsen painful menstruation? Things that can cause or worsen painful menstruation is bloating of the stomach caused by eating of food that are high in trans fat, eating of sugar, eating of food that are high in sodium, and also taking a lot of caffeinated drinks. These are the things that can worsen painful menstruation. What can you do if you're having bloating and you're having painful menstruation? Drink plenty of water. Like I said before, drink about 1.5 liters to 2 liters of water to relieve the bloating, and so the painful menstruation can stop. Painful menstruation medication. There is no one drug fits all. Like I said before, start with paracetamol. If it is not relieving it for you, go for NSAIDs like ibuprofen, diclofenac, naproxen, and Velvin. If none of them is relieving it for you, go for combination drug. If none is relieving it for you, there are triple drugs. If it is still there, go meet a gynecologist, go visit your doctor. They can prescribe a prescription drug for you. And thank God that the other drugs I mentioned are over-the-counter medication, so you can get them without medical prescription. You can talk to your pharmacist, explain to them, or talk to your healthcare provider, explain to them, and they will provide you with what you need. Take charge of your life. My story started with when all the medical people that are in my own area were continuously prescribing the same type of drug. Even when I tell them that that drug doesn't work for me, they will still prescribe it for me, and they felt maybe I was not taking my drug. That was why I kept on saying the drug was not working for me. So my breakthrough came when I discovered the combination drug and I started taking them. That was when I had my breakthrough. So if you have such health professionals that are not inclined to pain, because most times there is this bias that painful menstruation is not really painful, it's just the person not being able to tolerate their pain. Yes, there is this bias which needs to be talked about, which awareness needs to be created. Everybody is different, because my own menstruation was severe. It causes vomiting for me, it causes diarrhea for me, it incapacitates me, it makes my day that day so useless and disorganized. At a point I used to add my period not to come when I have something very important to do, like exam, in my prayer points. Yes, it was very bad. I miss school, I miss lecture, I miss certain important things in my life. So it was very bad for me until I discovered that drug. So you can take charge of your own life. If you have medical personnel that are not inclined to understanding that people pain degrade fast, you can take charge of your life. Go to the pharmacy, request for over-the-counter pain relief. Tell them that you want combination like paracetamol and ibuprofen, paracetamol and diclofenac, paracetamol and caffeine, or ibuprofen and caffeine, or even the one that I mentioned before. Try it out and see if it will work for you. So, in conclusion, take charge of your life. No shame in menstruation. It means that you are healthy. It means that you are fertile. It means that you are a woman. So there is no shame in menstruation. Hashtag making menstruation a normal fact of life.